Reading, burns and leg ulcer treatment. ReCell spray on skin is a type of autologous cell harvesting process. By coating a wound or skin defect with a layer of regenerated skin cells, the healing process is accelerated markedly. Scar formation is minimized and tissue rejection is also avoided to a large extent. Pigmentation can also be reintroduced to the skin, for example in cases of pigment loss in burns. These features make the ReCell process of interest in cosmetic, plastic and reconstructive procedures. The harvesting procedure enables cell processing at the site of treatment without the use of specialized laboratory staff. The process involves taking a small skin biopsy of about 2 cm². The skin sample is then incubated in an enzyme cocktail for about 20 minutes. Once processed, the cell suspension is available to spray an area up to 80 times the area of the donor biopsy. The wound is then covered with the dressing. The dressing falls off after new skin starts to grow, between 5 to 7 days afterwards. In 2012, the Australian-based company, Avita Medical, obtained regulatory clearance for ReCell in Europe, Australia and China. US and Canadian researchers had tested the spray on skin on 228 people with chronic leg ulcers. Leg ulcers typically heal very slowly and affect around 1.5% of the general population and over 3% of people over the age of 70. Management of leg ulcers using compression bandages heals about 70% of ulcers on average. After 6 months, skin grafts taken from other parts of the body are generally used for large areas which have not healed completely. Skin grafting is expensive and requires long hospital stays. In contrast, the ulcers of more than 60% of patients sprayed with ReCell were healed within 5 weeks. Almost all patients reported an immediate reduction in pain within 24 hours of the treatment. Experts also claimed that faster healing could save money despite the cost of the spray. The National Institute for Health and Care Excellence is currently conducting further research on the use of ReCell to treat burns. Early thinking was that the ReCell system showed promise. However, further research on patient and systems benefits was needed, before recommending its routine adoption in the NHS.